So I'm actually presenting in about an hour about the applications of telehealth in medical tourism. So I've been involved in this telehealth, or some people might call telemedicine, field for about 22 years, actually starting with the U.S. space program as an engineer designing telemedicine systems for the space shuttle and space station programs, and then got involved in the more clinical and research aspects of this in academia. So I've been involved in this for a while. Really a simple way to look at telehealth is using technology to provide care at a distance. Right? So there are a variety of different ways that we can practice telehealth, and there's really kind of two operational models, one being real-time, often using video conferencing, where a patient, usually with a nurse or a medical assistant and special technology, are at one end, and then the physician or the specialist are at the other end. And so that nurse or medical assistant acts as the physician's hands, and they work under their direction, and they use different instruments to remotely examine the patient, to interview the patient. So they might use a video otoscope to look in the ear, or a special camera to look at the skin, or electronic stethoscope to listen to the heart and lung sounds, or maybe use an ultrasound machine for obstetrics or for echocardiography. Really just about any device that produces a video signal of some sort can be transmitted in this way. So many different applications of this. And then the other way is via what we would call in the telemedicine field store and forward, where I'm temporarily caching data somewhere, and then at some point later the physician will review this. So radiology is a big example, and actually it's interesting, the term teleradiology isn't even used anymore because it's just radiology, right? That we have radiologists from around the world that are reading x-rays and other images. And so too, I think at some point in the hopefully not too distant future, we really won't have this telehealth or telemedicine term. It'll just be healthcare or just be medicine. So really what we're talking about is using technology to more efficiently distribute healthcare resources, right? And so the resource we're distributing is physician expertise, right? And fortunately, I would say that medicine is probably 85% cognitive, and that translates really well to digital technology. So in other words, a physician or specialist or other health providers using their brain power to process a bunch of different kinds of information. It could be a patient exam, could be test results, lab data, things like that. So physicians directly observe, they hear, they read, they do all sorts of different things. Most of that can be done remotely, or maybe even more efficiently using technology. So in medical tourism, one of the challenges we have, especially in surgical tourism, is a patient may go to another country, they have to get there early to do all their preoperative assessment, then they have to stay in country for a while as they recover, and then they get back home. A lot of times the physicians locally don't want to handle the follow-up that's done by for a surgeon or a physician in another country. So I think the application of telehealth and medical tourism is on the front end, making the preoperative process more efficient. And actually that's happening at the Veterans Administration Hospital in Miami that does the cancer surgeries for the VA, or Veterans Administration Hospital in Orlando, which is about 4.5 hour drive away, and the West Palm Beach VA, which is about 1.5 hours away. So what was happening before was the patients would drive down to Miami, have their preoperative assessment by either the anesthesiologist or the surgeon, then they would drive back to their hometown, and then 10, 12, 14 days later they come back and have their surgery. Now they're doing all those pre-op assessments by telemedicine. So they're saving the time for the patients and their family members. So we could do this internationally as well. So that's at one end. That's, you might say it's perioperative, so it's kind of pre and post-operative, because in terms of the recovery after the surgery, telemedicine can be used to be able to see how the patient's doing, do wound checks, things like that. So I think we're right on the verge. Now, we personally aren't doing a lot in medical tourism right now in terms of using telemedicine. So what I'm here at this conference to talk about is the possibilities of using telehealth. Because as I mentioned before, I've been doing this for over 20 years. But I think we're on the verge of it taking off. Now, naturally, our area of kind of influence is in the Americas, right, in the Caribbean and Latin America, and to a lesser extent Canada. So I'd imagine that'll probably be our first our first real specific application in medical tourism. But we've, for a number of years, I think now for a little bit over 4 years with Royal Caribbean Cruises, and now for a little over a year with Carnival Cruises, have been doing telemedicine to support crew members on these different cruise lines. Now that's tourism and really employer health or employee health, but it has analogs in medical tourism as well. Well, I think probably the first place you'll see it is multinational corporations that have employees dispersed throughout the world, and they're different. I'm not making a value judgment. There's just different healthcare systems and different levels of care that are available. So you may have some employees that are working in a challenging environment that may not have the best medical care, that this would actually allow them to get access to something that's more akin to what they would get back in their home country. Right, so I mentioned before what we're doing for the cruise lines, for their employees at sea. It's truly international. I mean, Royal Caribbean has cruises all over the world, and this is for their crew. We do see some guests occasionally, but it's mostly for their crew, and starting with dermatology, because they have issues accessing dermatologists. So one of the things I mentioned before was there's this kind of store and forward or asynchronous mode of telemedicine, and that's what we're doing for dermatology. A fairly inexpensive digital camera and a secured digital multimedia medical record system allows the cruise ship physician or the nurses to take 4 or 5 photos of the skin problem that the crew member might be having. And they take a dermatologic history. It all gets wrapped up in a secure bundle and gets sent back to the University of Miami, and then one of our dermatologists will actually review it and get back to them within 24 hours if it's acute, or 72 hours if it's routine. Well, so another way to look at telehealth is it's a way to reduce friction in healthcare, right? So there's a lot of friction, or you mentioned a pain point around. So you imagine somebody wanted to get a second opinion for their cancer diagnosis. So let's say they're somewhere in Latin America and they want to come to Miami to see one of our oncologists or somebody. They get a diagnosis they're not quite sure about, or they just want to make sure that they have that particular form of cancer. What happens now is that there's quite a bit of information that has to be collected in paper-based format. It has to be mailed. The mail package is received. Missing information has to be requested in that, whereas just something simple like that, if you have a smart digital system on the front end that you can actually incorporate all those data and then actually have the physician, the specialist, actually examine the patient themselves, interview them, do all that, actually before they actually even come, before they do any travel. So maybe you could even just render the second opinion completely virtually, and then if they require surgery or some sort of procedure, then they travel. So that's a major efficiency improvement right there. Especially when you consider how difficult international travel is to the United States now, if that's the destination post 9/11, is that we've seen major shifts in where patients are going for their international medical care because of the post 9/11 restrictions on travel in the U.S. So you've seen this shift to Thailand and Singapore and India and other parts of the world, largely because people couldn't get visas to come and get care in the United States. So it's actually a pretty big gap, and I think the gap is between innovation and regulation, right? So you've got most of the innovation that's happening right now is in wireless networking. It's really in consumer electronics and the personal computer industry. In the wireless industry is happening so fast, and regulation is so far behind. So you put that on top of the fact that healthcare as an industry is generally fairly conservative in adopting new technologies, new information technologies. So I think what's possible is way ahead of where we're actually applying the technologies in healthcare now. There's a real interesting tension in this field because innovation is far outpacing regulation. So the healthcare industry is slow to adopt new technology innovations because of a really fear of litigation is what it really comes down to. And you add on to that, there's kind of inherent conservatism in healthcare towards new technologies that even makes it a bigger gap. The technologies become a lot more consumerized, right? So you have these movements like there's this whole concept of BYOD, or bring your own device, where companies aren't assigning cell phones, they're not purchasing or assigning cell phones or tablets to people. They're deciding what they want to buy on their own, and they're bringing them to work, right? So a lot of people now are buying their own technology that they carry with them all the time or they buy for their home. And so there's a demand from physicians and other health providers as consumers. They say, well, I can do this thing. I can have a video conference with my daughter who's across the country or across the world. Why can't I have a video conference with a patient? Right? So I think that's probably where the gap's going to be bridged somewhat, is both from the healthcare providers and from patients too, because patients have access to all this technology and they're buying it themselves because it's consumer price now.